If you've recently been diagnosed with axial SpA, remember that it takes time to understand your condition and to get used to medical appointments. Over time, it will get easier. It's normal to feel a mixture of emotions before and during an appointment. Some people feel anxious or overwhelmed, but preparing well beforehand can help you with this. Preparing also gives you the best chance of getting the most out of your appointment. Some hospitals have information about their staff and departments on their website, and it can be nice to read this before an appointment to reduce any feelings of anxiety. Visit the hospital website and use the search function to find the rheumatology department information. Do remember the website information may not be up to date or complete. Bear in mind you may not see the person named in an appointment letter on the day. In some hospitals, you may see a different healthcare professional who works with your consultant. For example, some teams include occupational therapists, specialist physiotherapists, nurses, and others. Research the practicalities in advance. Think about how you'll get to the appointment, including public transport or parking, and where in the building it is. Aim to arrive early to give yourself a chance to mentally prepare for the appointment. Sometimes clinics can run late, or you'll be sent for tests, such as blood tests, as part of your appointment, so allow plenty of time on the day. If it's an online or telephone appointment, ensure you have somewhere private to take the call and you're able to focus, free from distractions. A couple of weeks before, set aside time to reflect on what you discussed at your last appointment. You may like to look at your previous clinic letter to remind yourself. Consider how things have changed since, and if there's anything you've been struggling with. Ask yourself what's been going well since your last appointment. Even if you don't share this on the day, it's important to recognise when something's going well and celebrate your wins. If you're taking medication for your axial SpA, think about how much it's working and any side effects you're experiencing. Think about the things you've been doing to support yourself between appointments. For example, what activity or exercise you've been doing. Don't forget to think about how your condition is affecting you at night and the quality of your sleep, as this can sometimes be overlooked. Similarly, how are your symptoms in the morning, and are they impacting your work or social life? Consider other symptoms you experience that may be related to your axial SpA. For example, any skin issues, eye problems, or gut symptoms. Do mention these on the day. Your team may be able to advise, and these symptoms may change what treatment options best suit you. Finally, reflect on how you've been coping emotionally. Consider how your condition is impacting your mental health and discuss this if needed, as your healthcare professional can provide advice and refer for support. If it's been a long time since your last appointment, it can be difficult to reflect back. You may find it useful to track your symptoms regularly to help with this, so do watch our video linked below to learn some practical ways to do this. Speak to friends and family, as they may have suggestions or things they've noticed. Consider any questions you'd like to ask about the future. For example, if you want to start planning for a family, changing job, or have a big life change coming up. Once you've taken the time to reflect, make a list of all the things you'd like to discuss, then mark down the top 2 to 3 priorities for you. This helps to ensure you discuss the most important things in the limited appointment time. Use our preparation worksheet linked below. It includes a space to list all your current medication and supplements, or you may prefer to keep your notes on your phone. If your hospital sends you questionnaires or forms to complete, set aside time to do this beforehand. They help your team understand how you're managing and what medication options you're eligible for. You may like to ask a friend or family member to attend the appointment with you. Loved ones can help us remember what we want to discuss, may think of questions we wouldn't have thought of, can help remember and process after the appointment, and can help in practical ways, such as providing translation or help with communication. Do think about what you'd like to discuss at your appointment, as this may change which friend or family member you're comfortable having attend. It's also important to discuss with them beforehand about what you'd like from them. For example, would you like them to be involved in the discussion, or would you prefer they observed only? Over time, it gets easier to prepare for an appointment, and you'll find ways that work best for you. Do share your experiences and advice in the comments below. then watch our next video for advice on things to do during an appointment.